The renal system parathyroid hormone. The parathyroid hormone, or PTH, is produced by the parathyroid glands in response to decreasing circulating calcium levels. Maintaining homeostasis. Homeostasis requires that volume and osmolarity be preserved. Blood volume is important in maintaining sufficient blood pressure, and there are non-renal mechanisms involved in its preservation, including vasoconstriction, which can act within seconds of a drop in pressure. Thirst mechanisms are also activated to promote the consumption of water lost through respiration, evaporation, or urination. Hormonal mechanisms are activated to recover volume while maintaining a normal osmotic environment. These mechanisms act principally on the kidney. Diuretics and fluid volume. A diuretic is a compound that increases urine volume. 3 familiar drinks contain diuretic compounds: coffee, tea, and alcohol. The caffeine in coffee and tea works by promoting vasodilation in the nephron, which increases GFR. Alcohol increases GFR by inhibiting ADH release from the posterior pituitary, resulting in less water recovery by the collecting duct. In cases of high blood pressure, diuretics may be prescribed to reduce blood volume and thereby reduce blood pressure. The most frequently prescribed antihypertensive diuretic is hydrochlorothiazide. Regulation of nitrogen wastes. Nitrogen wastes are produced by the breakdown of proteins during normal metabolism. Proteins are broken down into amino acids, which in turn are deaminated by having their nitrogen groups removed. Deamination converts the amino, or NH2 groups into ammonia, NH3, ammonia ion, NH4, urea, or uric acid. Ammonia is extremely toxic, so most of it is very rapidly converted into urea in the liver. Human urinary wastes typically contain primarily urea with small amounts of ammonia and very little uric acid. Elimination of drugs and hormones. Water-soluble drugs may be excreted in the urine and are influenced by one or all of the following processes: glomerular filtration, tubular secretion, or tubular reabsorption. Drugs that are structurally small can be filtered by the glomerulus with the filtrate. Large drug molecules such as heparin or those that are bound to plasma proteins cannot be filtered and are not readily eliminated. Some drugs can be eliminated by carrier proteins that enable secretion of the drug into the tubule lumen. There are specific carriers that eliminate basic, such as dopamine or histamine, or acidic drugs, such as penicillin or indomethacin. As is the case with other substances, drugs may be both filtered and reabsorbed passively along a concentration gradient. Diseases and disorders. Diabetic neuropathy. Diabetic neuropathy impacts the kidneys as a result of having diabetes type 1 or 2. Higher levels of blood sugar can lead to high blood pressure, and this additional pressure exerted on the kidneys causes destruction of the small filtering structures within the kidney. Glomerulonephritis. Glomerulonephritis refers to acute or chronic nephritis that involves inflammation of the capillaries of the renal glomeruli. It has various causes and is noted especially by blood or protein in the urine and by edema. If untreated, it could lead to kidney failure. Hydronephrosis. hydronephrosis is a condition whereby the kidneys begin to swell because of the retention of urine. Several conditions can cause hydronephrosis, such as a kidney stone or blood clot. Treatment will vary depending on the cause. Polycystic kidney disease. Polycystic kidney disease is a genetic disease where cysts grow inside the kidneys. The kidneys enlarge from the cystic collections and damage to the filtering structures of the kidneys can occur. As the disease progresses, it may lead to chronic kidney disease. Renal cell carcinoma. Renal cell carcinoma is a cancer occurring in the kidney tubes where urine is produced or collected. This one of the most common cancers found within the kidneys. Removal of the cancerous lesions is the typical approach from a treatment perspective. Renal failure. Renal failure occurs when kidneys suddenly or gradually become unable to filter waste products from the blood. When kidneys stop filtering, a high level of waste may build. Two types exist: acute kidney failure and chronic kidney failure. Cystitis. Cystitis is inflammation of the urinary bladder, often caused by infection. A chronic form of this condition is known as interstitial cystitis. Symptoms of cystitis include bladder pressure, voiding frequently, and pain. Urinary tract infection. A urinary tract infection, or UTI, is an infection caused by bacteria or sometimes fungi. The exact type of bacterial growth is determined by conducting urine for culture and sensitivity, or CNS testing. In rare cases, a UTI may be caused by a virus. Urinary incontinence. Urinary incontinence is a loss of bladder control. Those afflicted with the condition will experience urine leakage from the bladder. Weak bladder muscles are a risk factor for developing this condition. Medical specialties and procedures related to the urinary system. Urologist. A urologist is a medical specialist involved in the diagnosis and treatment of urinary and male genitourinary system conditions, disorders, and diseases such as prostate disease, renal and bladder dysfunctions, and others. Procedures and testing. Urinalysis. A urinalysis is a microscopic group of urine testing. This test detects and measures several substances in the urine, such as products of normal and abnormal metabolism and bacteria. Urine for C and S. It stands for urine for culture and sensitivity. Urine produced by the kidneys is analyzed by way of a urine culture test, which can detect and identify bacteria in the urine which may be causing a urinary tract infection. If harmful bacteria is found, a sensitivity report is generated. This report lists antibiotics sensitive in the treatment of the bacteria present. 24-hour urine collection. This is a test whereby all urinary output is collected over a 24-hour period of time. The analysis of urinary output over this extended period of time provides a greater indication of normal or abnormal kidney function. CT scan of the kidney. Computed tomography is a diagnostic imaging procedure that uses a combination of X-rays and computer technology to produce a variety of images. It provides detailed images of the kidney looking for disease, cancer, obstructions, and other kidney conditions. Cystoscopy. A cystoscopy is a procedure allowing a physician to check for bladder or ureteral problems such as bladder cancer. An endoscope, also known as a cystoscope, containing a camera at the end of it, is used. Dialysis. Dialysis is a treatment that removes waste products from the blood when the kidneys are not fully functioning. This type of therapy is available at home or in a hospital or clinic, and there are two main types: peritoneal dialysis and hemodialysis. Intravenous pyelogram. An intravenous pyelogram, or IVP, is a specialized X-ray designed to produce views of the entire urinary tract. A dye is used to secure the enhanced imaging. The X-rays can also show how well the urinary tract is functioning and to identify any blockages. Kidney scan. A kidney scan is an imaging test which views the kidneys. It is considered a nuclear imaging test as it uses radioactive tracers to pick up hot or cold spots within the kidney. These variations are considered abnormal. Kidney transplant. When kidneys fail or when a person is in end-stage chronic kidney disease, a surgical procedure is performed in the form of a kidney transplant. This procedure involves harvesting a donor kidney which is transplanted into the recipient in need of a functioning kidney to support vital function of the urinary system.